So we are live. Okay, so I think we are live. Hi, good evening, everyone. So if some of you can please confirm if the audio and video from our side is okay. So we can have a small chit chat, we can have a small discussion with all of you. Hi, Vikas, good evening. Okay, so hi, Dr. Niha, good evening. How are you?
Hello, sir. I am good, sir. How are you?
All good, ma'am. All good. So audio is clear. Thank you so much, Vikas, for confirmation. So, guys, this section, this video, this small, interactive session we have kept just to give you the idea how this exam NEET 2021, the second last you can say, before the last one that has been announced next year 2022. So how this has been and how different students have given their opinion. So we have floated one Google form. If you are one of those who have filled that form, this is as per your opinions only. Okay. So the opinion that we have got from that the things that we are going to share today with all of you, it is an opinion basically from almost 700 to 750 responses that we have got today in one day, and that's I think a huge response from all of you. So first of all, thank you all so much for taking out time after your exam and filling that Google form to provide us the opinion. So, ma'am, I do believe that you might also have got so many messages and all the Google form and all. You have read that. So,
Yes,
I just want to know from you, uh, what was the kind of response that you got from majority of the student? How was the kind of paper it was?
Yes, sir. So definitely, I would like to thank all the students because they were very, very cooperative and they took a great part in giving us the feedback. So, what I could get from those reviews is that the paper was not difficult. Now, I think that should be taken other way around also, that it was not difficult for these students, for our students. Maybe it was difficult for others, but the kind of preparation these students were having, they were not feeling it difficult. So most of the students said that it was average to a difficult kind, and I think that is good, because those students who study, they never want that paper should be easy. Like, that won't make a difference between the students who have studied and who have not studied. So they said that the are last minute 10 most important topics, the last leap that we did, the power course. So I think that is a great reward for all of us, that whatever we did in these pandemic crisis to ace the preparation of these students when they were finding difficult to keep on the track. Basically the problem was how to keep on track.
Yeah.
And so they said that actually that paper reminded of the DBMCI mocks also. So I think that is a great line, that mocks were difficult than this paper, so they were prepared for even a difficult paper than this. And they said that the 10 most important topics that we did, the image based sessions that we did, and the last leap, they were highly, highly useful. So I think all kudos to all our faculties who really worked hard in this time and did this YouTube sessions. What do you feel, sir, about the clinical subjects?
I think basically the biggest reward actually should go to DBMCI Live.
Exactly.
So all the students, one message that I got, a kind of message which I've got so many from the students, that, sir, one thing, you may talk about any other thing, but one thing which keep us every time on the track, which kept us all the time, it was the DBMC Live. And because of that, we were having access to the live classes. And I had eGurukul also, I had applications also, other all the things. But the nothing can replace a live class. So all the time you were after it, and your faculties were after it कि आज सुबह शुरू हो रहा है, शाम को खत्म हो रहा है, you have to give the test. No doubt it was somewhat hectic. That is what they said, कि sir, no doubt it was hectic, but at the end now it feels like it was rewarding. So the live, to come on the DBMCI live platform, to relay our live classes to the live batches and to the student onto their mobile devices, was actually the game changer that I feel, because of the messages that I've got from the student. Because applications, recordings, they cannot help. Second thing, as you said, hi Pinky, hi. Okay, Tanveer is saying, Manzoor is saying that हाँ सब DBMCI से ही आया था. So if that is a sarcasm, that is, then also it is thank you. If it is in real, that is also it is thank you. So thank you so much. So to keep us on toes all the time. So it is all okay. We are not here to tell you that sab DBMCI se aaya tha. Nobody said a single line. Dr. Praveen had a session in which he clearly said, ma'am, I don't know whether you saw his session or no. In one of the questions, Dr. Praveen clearly said that yes, this was a question which I did not taught. And it really needs a lot of guts to say that this was not from my class. So no, I don't think that any faculty from DBMCI is saying that everything is from my notes. What we all have been emphasizing all the time is to stick to the basics and concepts. And if you are sticking to it, I think question may come in any language, any form, you'll be able to crack it. So these kind of sarcasm also, these are the moments which we keep us happy, smiling. That's okay. We have these kind of students everywhere. Those who will be all the time, sarcastic, and that's absolutely okay. That's fine with us. So if I tell you from the clinical part, ma'am, the response that I got from the student, they simply tell me, yes, some 40 to 50 questions were like one-liners. And rest of the questions, they were having, some 4 to 5 line of questions. So no doubt it was taking time, but yes, they were able to revise their paper. Second thing they said, sir, ortho was not that tough. But point is, you cannot leave out anatomy out of it. So like, I'll tell you about one question. One of the question was about muscular cutaneous nerve. So muscular cutaneous is something which I usually take in my peripheral nerve injury basics, in the basic part of the nerve. I'm not talking about the detailed injury of muscular cutaneous, but basic. So one of the students said, sir, this is a question of anatomy. So my simple message to every student is, orthopedics is anatomy. If you know the anatomy, the troubled patient is coming to me. Yes. So anatomy is everything normal. When it is getting some trouble, he's coming to me. So without reading anatomy, without, you cannot just bypass Dr. Ashwini to come to me. So if you're bypassing him, you can't learn from me. It's as simple as that. So any student, my message to all the student is that please don't try to think that when the NEET is going and the next is coming, so there will be the pre and paraclinical subject will be of less importance. No, they are your base. Some of the sections might be like, which are not that important, but you will be amazed to understand this. From biochemistry also, we had this image-based question this time. Yes. So there were some close to some, but 30 to 40, in fact, more than that images out of these 200 questions. Some of the images were from biochemistry also. So clinical things are important, no doubt, for next purpose or for the next NEET, which is proposed in April 2022. But obviously the pre and paraclinical subject will have a role to play. Without, you try to bypass them, half of the clinical part is already lost. So I think you have to learn that. So ma'am, what do you think about, okay. So what do you think about the opinions that you have got from all the sessions that we have been doing live also, other than the last sleep, other than the power course? There are so many multiple sessions that we have been keeping, free of cost and all the time YouTubes and lives and all. You have got any response about them?
Yes, sir. Definitely. Thank you so much, Sanjana, and Vipul also. Thank you so much. One thing I will agree with you, sir. See, no doubt clinical subjects were predominant, like clinical was asked more, but we cannot reach to the clinical subjects without going through these basic one. I cannot reach to the top of the building without actually ascending through the stairs. So these basic subjects, the basic sciences, that is your preclinical and paraclinical, are like stairs. So if you do not go through them, you cannot reach So a strong foundation is definitely required. Every time I start my subject also, I always start with the anatomy. So obviously when you are doing the surgery, when you are doing medicine or orthopedics, even radiology, I think you require a sound knowledge of anatomy. So basically you will be asked these subjects in a clinical form, but you have to do them, you cannot skip them. There is no shortcut. Okay, there's no shortcut to success. And yes, as sir was asking, I think I have got, you know, uncountable number of responses that these sessions were highly useful. One thing, when I was doing these sessions, as I was doing it almost, you know, daily, even I was started having a self doubt that should we do it daily, like are we disturbing the students, or we are really helping the students. And even then I used to ask the students that do you want these sessions even next week. Even last Friday I asked them, see guys, next Friday is just before, one day before your paper, do you want it? And like it is like 7 or 8 p.m, late evening, and they say yes. And they were true to their words, they joined the session, they joined the session and they were enjoying it. So definitely I think I don't have to ask them now, when they were joining the session even one day before the paper at 8 p.m and they were answering, I think the answer is in front of you, sir, that they needed it, they were enjoying it. And I think people are saying that last leap video were very high yield. And I think all thanks to the faculties, their expertise, who brought their best from their experience. That were not just the last leap, that were not the just 10 questions, not the 10 topics, that was, you know, the you can say extract of their hard work and experience of so many years. So we are getting so many thanks, sir, for this sessions, I think, sir.
One thing I would like to inform all our students, ma'am, when I asked a simple straightforward question in the Google form, that direct questions were from the pre or paraclinical subjects. Were there some direct questions? Though some 10 to 20% said ki no, there were no direct question from the pre and paraclinical subject. But I'll tell you, around 70 to 80% people, the students, out of those 750, 49, something like that responses we got, 80% people, they said that yes, there were direct questions from the pre and paraclinical subjects. That is another important thing which I want to emphasize upon, that guys, please don't fall into trap of anything. Only clinical, only medicine, only surgery. No. What are medicine and surgery? We need to understand. What is medicine? When I tell every student, I tell in this way only, what exactly is medicine? It is a simple physiology which has got some pathology and is being treated by pharmacology. That is your medicine, as simple as that. So if you're not able to understand the basic mechanisms, the basic physiology, how you are able to make the medicine things, right? It's as simple as that. If you talk about the x-rays, x-ray today exam, we had an image of x-rays. You know, that x-ray question can be from radiology also. X-ray question can be from orthopedics also. That is same thing. I also teach. Dr. Rajat is also teaching the same thing. But point is, from where it is coming? It is coming from anatomy only. Epiphysis had a clue. Metaphysis had a clue. You know, if you don't know about the basic things of anatomy, how can you easily make out whether scurvy or rickets or something else? So pre and paraclinical will remain all the time important. They are the base. Yes, some part I do agree. Some part we have to shed off, and maybe 10%, 15%, 20%. The faculties, depending on their expertise, they will do it. I'm sure about it. So rest of the content will be your base and you have to read it. So that is very important again, I would say. And yes, how many images? I've already told you. Some people told ki like 30, 35 images, some 40 images were there. So we have got a broader range from 25 to 40 images that they were there. Not absolutely image-based question, but they were a part of the, you know, MCQs. So images were there definitely. So I would again recommend each one of you that whenever you are trying to read yourself, now when the NEET is coming, I do believe that I have said in my session, ma'am, I have said in my session also, just at around 5:15, I took my session of orthopedics. And in my session also, I said this thing very clearly, straightforward, and maybe probably bluntly, that anybody who feels like that, it was not his best shot. So anyone, you know, feeling low at this point of time, take a break. Take a break for today, take a break for tomorrow, but from Monday onwards, start your preparation again. Don't wait for anybody to say, ki, you know, your result has come, you have not got a seat, or you have got a seat. See, what you are going to lose? Nothing. If you start from Monday or start from Tuesday, you're not going to lose anything. If you get a good rank, good score, that's absolutely okay. You have studied for another 20-25 days. Unfortunately, if your inner conscience says that no, I'm not going to do well, there is no harm in starting your preparation again. We are there for you. We can start it with you, and we can plan things for you. That's absolutely okay. Reach out to us, we'll do it. But point is, do not waste your time. After a month, nobody knows what is going to happen. If you are good, fantastic, fabulous. So you've got another 2 to 3 months.
Sir, they would like to know when they can start their preparation. Is there any batch where they can join to start early?
Right now, we are starting 2 live batches. Okay. So on 14th of September, we are launching a regular batch. All the 19 subjects will be on DBMCI live. And this batch that we are starting on 14th of September, that will be ending somewhere in second week of March. So as per the rough draft, which has been released by NMC, it says that the most likely tentative date for the 2022 NEET exam is somewhere in April. So if I take it like first week of April or second week of April or third week like that, then even the student will be having minimum 20-25 days to revise the content. So that is how it has been planned. All the subjects will be live, like we have been running for last almost 1.5 years after COVID. And another batch is for the students who are already done with the 19 subject. Those who want to just revise, we are launching a TND batch, test and discussion batch, that is starting on 15th of September. And the ending date for that TND batch is again on 18th of March. So the schedule is already ready. It is prepared, the classes, the subject, everything is ready. So it will be launched on DBMCI live, and anybody, any student of DBMCI, not of DBMCI, if they want to join on day one to see what exactly DBMCI live is, how the classes are relayed, they can very well connect with our team. They can connect with me or you also, and we can add them to our first day class. Okay, so TND, we are starting with Dr. Niha only. So TND is your first class. So I think the schedule has reached out to you already, right? Yes, so we are starting TND with the ophthalmology class only, and regular batch will be starting with biochemistry class on 14th of September. So if anybody wants to see how the classes are relayed, if you are a DBMCI student, you already know how the live classes are played, how you can interact with the faculties, how you can get your doubt resolved, how you can post your queries, and after your class is done, the post-class tests are given, and for those tests also, how we provide you the solution. So for all DBMCI, you already know it. But if you're new to it, if you want to, be a part of it, you can very well on day one, we will allow everybody to be a part of TND also and to a part of regular batch also. So you can reach out to my team.
Sir, they are asking about the INI CET also, November.
So for INI CET, I think they were asking me about the date, and for the January session, the notification is already out. And I hope that every student has seen that. Okay. So for INI CET, Sanjana, again, I would recommend you. It is INI CET, no doubt. A mix of all the 4 premier institutes, no doubt. But again, I recommend the same thing. Please stick to the basics. Give as many as tests possible. Give the grand test as many as possible. And there is a misconception among the student that I am giving a test, I'm securing a low rank, and I will not go through. That is not the way to, assess yourself. All the time, forget about the ranks. Don't remember what rank you are getting. Rank 1 or rank 1000 doesn't really matter. What matters is, are you actually utilizing your GTs to the maximum? The best way is, when you give a test, go back home and check what all answers you have marked incorrect. Don't start searching from question 1 to question 200. That's a wrong thing. Only find out the negative ones, because you have already given a lot of time giving your test. So if you go back home and again see 1 to 200, again similar amount of time, that is not needed. Just check the negative ones, improvise on them. Just check, are your questions wrong from the same subject, same topic, or multiple subjects? If it reaches down to, let's suppose ortho is wrong, ophthal is wrong, open your notes and see whether that thing was noted in your notes or no. If the content is there and you have not been able to mark it out, only 2 things are possible. Either you are not able to remember it, factual thing, right? Either your concept is not clear, as simple as that. So if your concept is not clear, what I would recommend each one of you not to try to open up your notebooks, the standard textbooks. Better is to reach out to the faculties. Ma'am, samajh mein nahi aaya, dobara samjhao. And I'm sure nobody is going to say no to you, right? All the faculties, they have been working very hard for you. Even if you reach out to me, to Dr. Niha, to Dr. Raja, Dr. Ashwini, anybody, the first moment we all are free, we'll be responding back to you. right? So reach out to us and we'll surely do it for you. Whatever best we can, we'll surely do it for you.
They are asking about face-to-face classes also, sir. Kab hum start kare face-to-face classes?
See, face-to-face classes, we have already started at multiple centers. For example, Hyderabad is open, Vizag is open, Ahmedabad is open, Patiala, Amritsar is open, Mangalore is opening. So most of the centers are open, and this opening of the center purely depends on the permission granted by the governments, central government as well as the state government. Okay, we know that we are doctors now, we are already vaccinated. That's absolutely fine. But then still the COVID is, in some states, the cases are on high rise. So we have to take care of it. Your safety, my safety, it is equally important. Okay. I can tell you one student, he just messaged me yesterday only. Sir, today I got my COVID report. Will I be able to give my test or no? So I said, you should go to the center and you should see. I think they will allow you. But he was denied entry into the center. So this is very unfortunate. I don't want anything of this type to happen to you when you are about to reach your INI exam. Okay. So stay safe. Staying safe is the first thing. Second, about opening of the face-to-face centers, we are equally, eager to come to you as you are eager to come to the face-to-face classes, right? So as the state government allows, as the central government allows, as the rules allow, we'll open it up. So
they are asking, sir, in Delhi specifically, any chance of opening in Delhi?
Yeah, Delhi, we are opening in Gautam Nagar in this month only, September only. And I hope that Delhi team has already conveyed the dates to you. If you don't know about the dates, please message me. I'll tell you the confirmed date. I think, if I'm not wrong, we are starting from 17th or 18th, somewhere like that, if I'm not wrong. And even I'll be taking the class at Gautam Nagar somewhere on 24, 25, and 26. Right? Tentatively, that is a date for orthopedic class. So 24 to 26 is orthopedic class at Gautam Nagar. So Delhi is also opening with proper, precautions, proper safety, restrictions, and everything will be taken care of. So we are opening gradually Delhi also. So if you are asking about Darshan,
yes, Darshan is asking. Any idea?
Darshan, we are opening this Gautam Nagar on 17th, 18th, somewhere like that. I'm not sure of the exact date. So I think 18th should be the date or 17th should be the date to open it up. And then on 24th to 26th is my class, is the orthopedic class. So we are opening up Delhi also. You can just connect with me or the Delhi team for that.
So do we have any special TND for the INI CET? Those who are having the aim for this INI CET? Any separate TND?
Ma'am, this is under process. INI CET plan is under process. And I think I'll be able to tell you in this week only, in the coming week only, we'll be able to tell you about the INI CET TND also. So whatever will be the final call, we will discuss with the students what they exactly want. So if the students, they are convinced with the TND thing and everything else, so we won't hesitate to launch it. It's not a problem, but it depends upon the requirement and what best actually is for the student. So I need some 3 to 4 days to decide it. I'll surely convey to all in the coming week.
All right. So sir has given a lot of information, I think, and all the queries must have been solved for the students, the face-to-face classes in Delhi, then TNDs, and sir will be sharing soon the information regarding the TND, separate TND for the INI CET also. What about the NEET PG 2022? I think sir has told you it will be in around first week of April.
Ma'am, in April, actually, they have not said that it is first or second, but they have simply mentioned April 2022.
Yes. So April 22, I think, is quite specific. You can have any time in April 22. And that is why I think we are launching the batches so that we are completing in March itself. So you are pretty before so that you have time for the self-study and review also. What about the TND in Bangalore batch?
Sanjana, Bangalore team can guide you better about this because I heard that there are certain restrictions still at Bangalore. I had a word with the Bangalore team and they were telling me that the teams, the state government norms are not allowing them to function properly. So better would be, you can just connect with the Bangalore team and they will be able to help you out. But for the TND Bangalore or the TND, I have already told you, Vignesh, for the TND batch, we are starting on 15th of September and first class is of Dr. Niha only, ophthalmology. So ma'am is getting so many comments, so many, Niha ma'am is stunning and hearts and all, ophthalmology part. So your 10 topics was brilliant. No doubt, ma'am, the 10 topics most important, the last leap that we called, genuinely it was very, very nice, very helpful. Hi Rahul, good evening.
थैंक यू सो मच गाइस लाइक वो आई थिंक हम ही लोगों का आइडिया था और वी वर लाइक कीपिंग आवर फिंगर्स क्रॉस की लास्ट लीव के बाद शुड बी गो फॉर द 10 मोस्ट इंपॉर्टेंट टॉपिक्स और नॉट एंड दिस इज लाइक बाय द स्टूडेंट्स थैंक्स अ लॉट
Where is Kala Buragi? Can you please be specific? I actually very sorry for this, but I don't know about this center. Where exactly? Can you
सर
mention the state?
you gave one lecture they are saying there
I don't know. Can you please? It's 2021. Your exact name is not here. If you can be very specific with the state and the center, then I'll be able to tell you out. Last leave was awesome. Thank you so much, Shubham. Last
शुभम
leave
इज
for
सेइंग है
INI-CET. Yeah, surely, Nikhil. We'll be having one last leave for INI-CET. We'll try to get it done. We always do it. Before this INI also, we had important questions about INI.
yes
And for
yes
the next INI also, 100% will be keeping it. Yeah. So, ma'am, I think we have taken this Kala Boragi is one query that is left, but I'm very sorry, dear. I'm not sure where this place is. So apologies for that. But if you can be specific with the state, I think I'll be able to help you out. So if you have any query, anybody about the batches, about the enrollments, about the academics, anything, if you want to connect with me for anything, you can just find me on Telegram. Most of you, I think you have my WhatsApp number.
sir it is
also.
Karnataka
Okay. It is in Karnataka.
yes sir it was Gulbarga before and it is
Okay.
renamed now
Kalaburagi. Okay, so Gulbarga, basically Gulbarga, the center is open. We already have one very active medico, who is in charge of the Gulbarga center. Dr. Tanveer is there, and you can go and meet her. She's taking care of the Gulbarga center. That is very much open now. The center is open. You can have classes inside this classroom also. So the center is very much open. And if you want, I can just provide you with the Nahid. Nahid, I can provide you with the connect details also. You can just send me a hello message on the Telegram. I'll provide you with the center details, center partners number also. And you'll be very much happy to see the fantastic center that they have developed for all the final years and all the students over there. The satellite center is genuinely awesome. The classroom, you'll feel like it's fantastic. Okay, so you can be there.
Sir, they want to know whether DBMCI live will continue after COVID times or not.
Yes, DBMCI live will continue for sure. We'll be continuing it. And see, for this year, for 2022, at least we are continuing with DBMCI live. It is for sure, it is there, right? But again, I'll recommend guys what happens. No doubt, live class can have a no match. But if you have a privilege, if you have an access to go to any of the classrooms, there will be nothing best than that. I'll tell you the exact reason why. See, DBMCI live is something which we came out in the COVID period, right? So that you don't miss anything live scheduled. But point is now when the things are gradually opening up, then you have a access to the live classroom. Go there. There additional advantages. You are sitting in between 10 to 20 people, 30 people, 40 people, like-minded people, those who are having or looking at the lecture at one time. And if anybody is having one single doubt, he will post it on your portal, and you never know, that is the doubt that was supposed to come to you after 2 days or 3 days. So you are in between your 15, 20 people, 50 people are there, and that gives you motivation that other people are making the notes. You cannot yawn, you cannot sleep, you cannot run away, and you cannot definitely open up your packet of chips and start eating in the class. So that you do at your home. You're having your rajma chawal. One of the students said me, sir, I'm having this with my class. So you cannot have your rajma chawal in between the class, and you have to be dedicatedly listening to the lecture.
Yes.
So I would recommend that if you want to, be a part of a live lecture, go to the classroom. And believe me, you will thank me for this later once you crack your exam. There is nothing like this feeling that everybody in the room is having a same target, right? The feeling of competition, the feeling of completion, the feeling of getting the doubts resolved is just awesome when you are sitting in between your friends. So try that. You can
So one Sabyasachi, she is asking that what she should do. I think you should take a rest, full relax for one day.
Yes.
Monday ko sochna whether to start again or you have done, because I think till that time you will have many recalls also. So
Yes.
you will get to know what percentage of your answers were correct, and that will help you even more to decide that which way to go. I think Sabyasachi. When can we expect the result? I think within 2 weeks they will give the results.
Yeah,
10
2
to
to 3 weeks you can keep it as, you know, time period, because they want, this is already a delayed session, so they don't want to delay it or stretch it for a long time. So 2 to 3 weeks, maximum 4 weeks, that's a month's time. So that will be the time period.
Rohan, how to study ENT and Ophthal. Even for this paper also, they were important. Like in 200 questions, you got about 14 questions of Ophthal. So अगर मैं एक दो integrated भी मान लूँ, but more than 10 questions were from Ophthal. 200 questions में से more than 10 questions of Ophthal means, so they will be similarly important for your next also. And I think if you have prepared well for this exam, the similar way you have to prepare, like we are preparing in the integrated way, in the clinical way, conceptual way, the same. We are moving towards the pattern of next all only, and you don't need to change anything. If we will get anything which is revised, then obviously we will be talking about that, and then you can change, not now. When can we expect the NEET 2022? So it is in April, I think. They have mentioned it that they will conduct it in April. Yes. April 22. Sir, I have also got so many reviews. What reviews did you get? How many questions were from DBMCI? Like sarcasm, apart from the sarcasm. But
Sabyasachi is not a she, he is a he.
Oh, sorry. I could not realize that it is he. But my answer will remain same. Sorry. Whether you are he or she, answer is same, hai na?
Sabyasachi, just take a break, and I'll again say, hang out with your friends, watch a movie, eat well, sleep well, enjoy the Saturday evening and the Sunday genuinely, because this is the prism from which you have to come out almost of last 1.5 years. So just enjoy these 2 days, because in today we had the recall session of patho and orthopedics, and tomorrow, and by tomorrow I think most of the subjects will be out.
Yes, Ophthal, they are asking Ophthal. I'll do it tomorrow morning itself. Abhi aaj
Okay.
Actually I was busy here. Otherwise I would have been doing the Ophthal recall live. But we are doing this, so I'll come in the morning.
So Rohan is saying 100% strike rate DBMCI. So Rohan, if you're saying truth, thank you again. If it is a sarcasm, thank you again. That's okay. Both are acceptable to us. We are okay with that. Okay. So that's absolutely fine. We don't, throw out student like others out of the group because you are posting like this. That's absolutely okay. Okay.
But I think, sir, like what, apart from this, the paper that we got, 750 people gave us the reviews that all was from the notes. So I think they cannot say lies, or they cannot say wrong. They were saying everything was there from the notes, and we have shared the screenshot of the notes also.
Yes, I have also shared in my PPT that I have discussed today, the live session that I've already taken on YouTube. I have already shared the screenshots from eGurukul notes.
Yes, so you cannot, completely back out from this, that it was from the notes, when we have already shown you the screenshots from our class notes, beta.
Yes. So Nikhil said very, very correctly that today's paper wasn't beyond the scope of notes. That's absolutely right. Yes. I agree to this 100%, because all the time, all the time in my classrooms, all the time in my lectures, all the time whenever I'm talking to you individually, I have already said, always said, stick to the basics, stick to the concepts. So this was just a simple basic paper. It was not, I would not say that it was easy paper, and I cannot say easy because it was not a one-liner paper. Had it been a one-liner, I would have called it easy paper, but I'm calling it a moderate to hard paper because of the theoretical content, 5 to 6 line, 7 line question paper like that. So I am again saying, stick to the basics. Basics will be there all the time in all the 19 subjects. And in any exam you are going for INI, you are going for NEET, always expect that 1 to 2 questions will be there, which will be outside your notes. You read it out from anywhere.
Yes.
See, I am teaching you that orthopedics, which usually a PG has to read for 3 years. So that 3 year of the content, from that 3 year, I'm extracting a 20-25 hours content for you. So it is not a guarantee that everything that I am telling you is coming in it. No, every time you have to expect a improvisation in the exam. That is what is expected. Our fight is not for that one question. Our fight is for rest of the 99% questions. Okay, so you have to understand that.
And we keep on saying that in the last, revise. I think in the last day also, Dr. Nachiket posted, just revise the notes, just stick to
Yes.
your notes. So obviously, if you are having a problem with recall beta, so you have to revise more. And they are saying, what is, according to me, the paper was, so according to me, paper was a good one. A easy paper is not a good one. So it was a good paper. It was not that lengthy. It was not that simple. It was not just the one liner. So it was a very, very balanced paper. When you are preparing, you have to get this kind of paper when you have to apply the knowledge. So you were getting less of the direct questions from the pre and paraclinical, but there were many questions which were actually needing the application of these subjects. Like even in OFTA, they said that there was a question of clot, which was compressing some optic chiasma, and they asked that which artery it is related with, anterior communicating, middle cerebral, anterior cerebral. So in every subject, like sir was also telling, in ortho also it was like this. So they were asking the questions which were requiring the application. And this is what you learn in the clinical case scenarios, how to apply your basic sciences, the knowledge of pre and paraclinical to the clinical subjects. That is what is making it clinical. So we are learning the clinical acumen by this. So I think it was a very, very good one. And especially when I get a review that options were quite twisted. See, a difficult question is not the one which is very long. A difficult question is the one which has got very close options. And that is why I always teach you how to rule out diagnosis of exclusion. Why this is the answer and why these are not the answers. So why these are not the answers is even more important than why this is the answer. If you know why this is not the answer, you will clearly get the right answer. You will be left with the right answer. That is the finest approach of doing the question. So I think it was a very, very good one. Question like next step. Now, Kapil, if you remember in my, clinical case questions, I have discussed this, that if they ask you the next step, what should be the answer? If they ask you the best step, then what should be the answer? So in each topic, you should know that flow charts that we have created, what is to be done next and what is to be done as a best. So please revise your notes. You will definitely get. Forensic will be useful in future next. डेफिनेटली जैसे जैसे हम लोग आगे बढ़ रहे हैं ना, मेडिको लीगल इंपॉर्टेंस बढ़ती जा रही है. सो फॉरेंसिक इज डेफिनेटली रिक्वायर्ड, नॉट ओनली फॉर योर एग्जाम, पर्सनली ऑल्सो. Patients are behind doctor, they are after doctors like anything. So I think medico legal की importance तो बढ़ ही रही है. बेस्ट मैनेजमेंट, नेक्स्ट मैनेजमेंट. हाँ, तो हम लोगों ने सबने ऐसे क्वेश्चंस रखे थे जिसमें हम लोगों ने डिस्कस किया था कि इन्वेस्टिगेशन ऑफ चॉइस, बेस्ट इन्वेस्टिगेशन, नेक्स्ट इन्वेस्टिगेशन, गोल्ड स्टैंडर्ड इन्वेस्टिगेशन, नेक्स्ट स्टेप टू बी डन, बेस्ट स्टेप टू बी डन. So please look at them. You will get those flow charts and definitely they will help. Twisted options the. Should we now mainly focus on clinical pattern? Yes, you have to focus on clinical pattern. And I think that is the reason why they decreased the number of questions from 300 to 200. So we predicted this in well advance. हमने बोला ही था. I think if you remember, we had a session, live session with Dr. Thamim also. And he did said that we are expecting longer questions and clinical questions in our exam this time because they have reduced the number of questions. So that was pointing towards that they will give you a clinical paper. Otherwise, they would not have decreased the number of questions. And that is why you got ample amount of time for review. I think it's a very decent time, sir. Agar 30-40 minutes review ke liye mil rahe hai after doing the paper. So I think this is very, very good. Cutoff. What will be the cutoff of government colleges?
Nobody can say this, but you can expect a higher cutoff this time. Somewhat higher cutoff this time. Let's wait and see. Okay, we'll try to plan a session on this, but you know, we at DBMCI at least we don't believe in working on inceptions and perceptions and this will happen, that will happen. We want to work on facts. So let the certain details come out, and then once we have certain details that we are looking for, increase in number of seats, the bond status, exactly how they are going to plan it, the center, the state, and then all. Every year we are keeping a counseling session. So depending on the facts, we can talk about this, not just depending on the perceptions, this may happen, that may happen. No, we want to work on the facts. So wait for some time. As we get certain details, we'll plan a session for you for sure.
Yes. So Satvik is saying that paper was well within the notes, but needed constant revision of the notes multiple times. So thank
Absolutely.
you, Satvik, and absolutely correct. You have to do it. If you remember, I told you don't read the new things. Read those old things multiple times. They will help you. So yes. Um, is it necessary to go in the depth of pre and paraclinical subjects?
See, there is nothing like a depth of the pre and paraclinical. There is nothing. To use the word depth is actually wrong. The word that we should use is integration. See, understand, I'll again explain to you. If in anatomy you're reading about brachial plexus, for example, what do you understand by the depth of that brachial plexus? The depth means the root, trunk, division, and cords. When you say the word integration, what exactly it means? That the initially the question of anatomy is something which is coming from the book. Question of orthopedics is something which is coming from the patient who is standing in the OPD. That is the only difference. So it is not an in-depth knowledge. It is a complete knowledge. In-depth means you keep on exploring. You keep on exploring more and more. No, it is not required. What you need to know, if a particular part of this nerve, if this plexus is gone, how he is going to come to me. That is what is being asked to you. So I would say that you start working or studying in an integrated manner. Whatever in anatomy you are reading, try to have an integration with the clinical part. For example, in ophthalmology also we had a question today. There is a clot in the brain somewhere, and it is compressing upon the optic, relay pathways, something like that. So that's a question of anatomy as well as of ophthalmology also. So you cannot say that it is a depth knowledge of ophthalmology. It is basically a knowledge of anatomy that you have been able to assess or understand because you are reading ophthalmology, right? So integrate whatever you are trying to read in your notes, in your university, in your college, in your coachings. Try to learn how the patient is going to present to me. The integration is important. Okay, so when you start integrating, you will automatically understand which part is not important for me, which part I can actually skip. So the thing which is not having any clinical integration part is not important automatically. So that you'll realize when you start preparing, integrating, and then start giving the test, you'll realize it automatically. I think, ma'am, we are done with most of the things.
Yes, sir. So counseling part, I think we will be having a different session after we get some facts about it for the rank and all. Otherwise, we have done with all the questions.
So for ophthalm part, Dr. Niha will try to take out some time tomorrow, and she will try to do it definitely on urgent basis as possible for her. So we'll get it done. Okay. So I think we are done with all these things, ma'am. So the purpose of the session is done.
Yes, sir.
Inform them everything.
So I think, guys, we had a good discussion, and now you must be able to decide whether you should relax or you should start again. If you want to try, we have given you the dates. You can come for the demo. And as you know, it's me only in the first session. So milte hai in the session and we'll have great fun. Don't hesitate to, start over again, because winner is the one who tried one more time. तो ऐसा नहीं होता है. Those who are winners, they are directly the winners. There are so many failures before actually winning. So don't hesitate. Okay, if you feel that was not, as sir also said, that it was not your best attempt, please don't compromise and come over again. It is hardly a matter of few months, and you don't compromise for your life, because this is not just a seat. This is your life, the designation by which you will be known till your life and even after your life, that he was an orthopedician or a surgeon or an anesthetist or ophthalmologist. So please don't compromise. If they can do it, you can also do it. You have to believe, and we are waiting for you, right? So all the best, guys. See you soon.
Thank you so much, everyone, for being a part of the session. Thank you, Rinsi, for arranging this. Thank you so much, and all the best, everyone.